Typically, healthcare is the one which is totally not correlated to software. So the idea in a typical portfolio is that when you have issues on the software side or the tech side, healthcare will help your portfolio. Now, why that also did not work very well, because there were, and all of this happened at the exact same time in the same week. That is more important. If they happened in separate weeks, it would not impact the markets so much. But all of this happened in the same 2-3 days. So what happened on the pharma side was that Hims and Hers, which is like the Amazon of pharmacy, they provide online pharmacy in the US, online pharmacy delivery in the US. They offered a compounded semaglutide for $49 per month, which is way less than similar patented products from Novo Nordisk. Now, Novo Nordisk and Eli Lilly offer patented weight loss drugs. And there are many other companies that are working on this patented weight loss drugs. But Hims and Her found a regulatory loophole whereby they could personalize it with some small ingredient change and could offer the same pill for $49, which shook the markets, which shook the big pharma company. Because if this was allowed, then a lot of other therapies, not only weight loss drugs, other therapies also, people could use that same loophole and provide cheaper drugs, generic drugs, at a much lower price compared to the patented drugs. Now, so that was the first few days. Immediately, there was a response from FDA. This is the fastest I have seen FDA move. FDA never moves so fast. Within 2 days, FDA got into action. The first thing was FDA Commissioner Marty McCurry. He issued a statement that there will be swift action against these companies who are using this loophole to make copycat drugs and selling it at a much cheaper price in the US. That was the immediate response. And if that was not enough, the very next day, the Department of Health and Human Services, which is obviously in the control of President Trump, he appoints the head of Department of Health and Human Services, right? So that department confirmed that they are starting or referring Hims and Health to the Department of Justice for potential violations of the Food and Drug Cosmetic Act. So this provided some comfort to the market. The market recovered to quite an extent, but obviously in the first 2 days, a lot of damage was already done. And again, I cannot stress enough the point that this happened at the exact same time when there was an issue in the software stocks, when there was an issue on the commodity market with gold and silver. So it seemed like a perfect storm where you had issues in the equity market, issues in the commodities market, and all of them hitting at the same time. And so it got a lot of investors really worried and nervous. We stick to our portfolio. We did a few changes because whenever such things happen, remember, a lot of stocks which are also not supposed to be beaten down are beaten down. That gives us an opportunity. We were looking at a few stocks from the last 2 years. We could never buy them. This gave us an opportunity to buy them. So we did make those changes to the portfolio where we entered a few stocks which we could have never done in the last 2 years because of the valuation. This gave us an opportunity.